So there are all these layers of social injustice that affect women more deeply than men. And if women are at disadvantage in this society compared to men, which is a pretty non-controversial statement, then HIV positive women are at a disadvantage compared to men in this society, even though the men who are infected are already a stigmatized group themselves because they are gay men. And the way I think about HIV infection in women is there are really two factors that affect them differently. One is biologic and one is psychosocial. There are lots of things that can be different for men and women in terms of biological manifestations of disease. Women certainly, by definition, are the only ones at risk for cervical cancer. And then women are more likely to have some problems around their menstrual cycle when they're HIV infected. Women, in general, tend to have menopause a little bit earlier when they're HIV infected than when they're HIV non-infected. And then all the misery that comes along with menopause and maybe doctors not understanding that all that can be controlled with hormones. And then later in life, it's frailty and bone disease. Already HIV positive people are more likely to have thin bones, and women are already more likely to have thin bones than men, and so they're more at risk for osteopenia and osteoporosis. There are also biological factors why women may get more sick on HIV medications, and that is not up to them or society to fix. That is up to the provider and scientists to think about men and women and think about them differently and stratify analyses by sex, enroll enough women in trials to look at these sex differences. It's up to the scientific and provider community. A lot of HIV research is neglected for women because it's so focused on prevention of transmission from mother to child. There has been absolutely a lot of talk about and a lot of stigmatization around women who are HIV infected and whether they should have children or not. It is certainly not up to anyone to decide but that woman. We have absolutely fail-proof almost ways completely to prevent the transmission from mother to baby during pregnancy. We have not had a maternal to child transmission in the city of San Francisco for 7 years. There's no problem in a woman wanting to be pregnant and just being a little more careful about taking antiretrovirals and keeping that baby uninfected. Absolutely. So in terms of diagnosis, in the current era, we're supposed to be doing routine testing, not risk-based testing. The idea is that we should be just testing everyone with HIV. This is not happening in the current era, and it certainly didn't happen before 1996 when those changes were pushed. So really who gets tested for HIV are people who are most obviously at risk in providers' minds, which would be gay men, maybe commercial sex workers, hemophiliacs, people who use drugs intravenously. So women are not always on that list and very infrequently on that list. So women often still present very late to care because they're just not thought of and they're not tested. Sexism and misogyny relates to really how women acquire HIV infection and social vulnerabilities. And that social vulnerabilities has to do with women not having power in relationships, women not being able to negotiate safe sex, women being raped as a method of war, women having no sort of say over their bodies. That kind of aspect of women's vulnerability to HIV is everywhere. So in this country, 85% of women living with HIV are either African American or Latino. It is a disease that disproportionately affects African American women. This is most manifest in the south and southeast of this country, where HIV is pretty much raging among women in a relatively unchecked way. So those areas that are most affected in this country and where Black people are more affected and infected have fewer HIV doctors, have fewer states where governors have decided to kind of make healthcare more universal. These are areas of the country that are most impacted by having reduced healthcare access, and yet these are all the places where African Americans are living with the disease. HIV is a disease of the poor. So already HIV is a disease that affects poor people disproportionately. A lot of providers got into HIV medicine because they were concerned about social injustice. Women are even more poor, even more disempowered. They often don't have the communities that gay men have that buoy you up, even in the face of poverty. And this is a lonely, unrecognized group. So in terms of violence and domestic violence, they both have a huge role to play in both HIV acquisition for women and not doing well for when HIV is actually acquired by a woman. So it's not really just about domestic violence, and we have to really think about the impact of institutional violence and violence as a method of war and mass rape and other ways that violence is inflicted upon women. And then when we think of domestic violence, really, this is just study after study that looks like HIV-positive women were more likely to have had domestic violence in their past or currently as compared to the general population. It is frightening to be a victim of any sort of violence, and so it can impact outcomes and adherence to therapy and virologic suppression rates and how people do. It does not make you actually necessarily want to go out and seek care and trust people and take your meds and do all the kind of very full of activity things that are required sometimes to take care of your health. So it is just completely permeating this epidemic for women. There's something very scary that I've been thinking about in terms of homelessness in women, and that's the possibility of rape. We haven't made housing as easy to afford for people in this city as we should. And because of that, men and women living with HIV are living outside. Women will not sometimes sleep at night because they are scared of the violence that can occur at night when they are more vulnerable sleeping outside. So I think homelessness has differential impacts, and it has to do with violence against women than homelessness has on men. Commercial sex workers have traditionally been a high-risk group for HIV infection, and countries who criminalize commercial sex work have higher rates of HIV infection in this population, and those who don't have lower rates. So it's completely related to criminalization of that particular industry. India is a really good example of this, actually. There is a state in India called Bengal who just has decided to unionize brothels, and everyone has to use a condom if they come in, and women have a lot more power in being in the commercial sex work industry, and the rates of infection among women in Calcutta who are commercial sex workers are very low. And then Mumbai is just the opposite. Brothels are run by the crime syndicates and the mafia, and they're very high rates of infection. So that's a good in-country example of what criminalization does. Yes, I think there is a problem in terms of public funding for specific programs related to HIV infection in women. And that's partially because women may not have advocated as much because they're not the dominant group living with HIV infection, at least in the Bay Area. That is also a problem of officials thinking this is not a problem in women, especially in the Bay Area, and certainly even countrywide. So women in a grassroots way are forming their own organizations, getting their own funding. World is an example of that in the East Bay, where they're doing all their fundraising by themselves to try to get a group together. And Rebecca Dennison really did that and started that because no one's doing that for them at the public health level.